Hello, welcome to our CARF Health and Safety Training. Today we're going to be talking about health and safety practices and reducing physical risks. Health and safety practices. Standard precautions. Standard precautions are a set of infection control practices used to prevent the transmission of diseases that can be acquired by contact with blood. Keeping hands clean through improved hand hygiene is one of the most important steps we can take to avoid getting sick and spreading germs to others. Many diseases and conditions are spread by not washing hands with soap and clean running water. When should you wash your hands? Before, during, and after preparing food, before eating food, before and after caring for someone who is sick, before and after treating a cut or wound, after using the restroom, after blowing your nose, coughing, or sneezing, after touching garbage. How should you wash your hands? Wet your hands with clean, running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from beginning to end twice. Then rinse your hands well under clean running water. Dry your hands using a clean towel or air dry them. Reducing physical risks. Every workplace has hazards. Our workplace is different than many others because our facilities are used as a temporary residence or to facilitate one of our drug Medi-Cal services. As employees of our common ground, we have a responsibility to look after our clients' safety and protect them against health and safety hazards. In order to manage workplace health and safety and help prevent accidents and sickness absence, it's important to identify, monitor, and reduce the risk associated with workplace hazards. What are workplace hazards? Workplace hazards are any aspect of work that causes health and safety risks and have the potential to harm. Some hazards are more likely to be present in some workplaces than others. And depending on the work that you do, there will be hazards that are more or less relevant to your business. What are the most common workplace hazards? There are many types of workplace hazards which tend to come under 4 main categories. Physical hazards are the most common workplace hazards that include noise and slips, trips, and falls. Ergonomic hazards. Physical factors that harm the musculoskeletal system, such as repetitive movement, manual handling, and poor body positioning. Chemical hazards. Any hazardous substance that can cause harm to your employees. Biological hazards, which include common colds and flus due to people not washing their hands consistently and/or groups of people living together or being in close proximity for extended periods of time. How do we prevent workplace hazards? The best way to protect ourselves and our clients from workplace hazards is to identify and manage them and take reasonable steps to prevent their potential to harm. In order to control workplace hazards and eliminate or reduce the risk, you should take the following steps. API: assess, plan, implement, and evaluate. How does OCG address safety management? OCG has a safety officer at each site. The safety officers are the residential site supervisor in East Palo Alto and the recovery residence site supervisor in Redwood City. The safety officers are responsible for establishing and monitoring contacts with companies to provide and inspect all safety equipment. The safety officers ensure that all fire safety equipment is inspected at intervals required by law. OCG has a safety committee that is comprised of the East Palo Alto Safety Officer, the Redwood City Safety Officer, the Quality Assurance Coordinator, the Clinical Site Supervisors, and a representative of the Maintenance Department. The Safety Committee meets monthly. The committee is responsible for implementing and monitoring the following areas: safety management and training, security management, hazardous materials and waste, emergency preparedness, infection control, safety-related incident reports, safety inspections, emergency drills, external inspections, and ensuring compliance with emergency plans. The Safety Committee submits monthly safety reports to the Continuous Quality Improvement Committee. Data from ongoing monitoring is evaluated to assess individual issues as well as trends. If problems or opportunities to improve the program are identified, a plan of action is developed and implemented. An internal safety inspection is conducted at least quarterly at each site. A facility run checklist report is completed and sent to the appropriate site supervisor. A corrective action plan is then submitted to the Quality Assurance Coordinator for any deficiencies listed. Daily facility runs are conducted on each shift, and an SOD packet is completed daily. OCG has a maintenance department. Maintenance requests are monitored by the maintenance department and the MMOC, otherwise known as the maintenance man on call. What do I do if I have identified a physical risk? If the physical risk will put our clients or staff in imminent danger, take corrective action immediately and then notify your supervisor. Note the physical risk on your daily SOD packet and notify your supervisor accordingly. Bring the physical risk or safety issue to the staff meeting to be discussed and put into the staff meeting minutes to share with all staff. Fill out a maintenance request to have a physical risk assessed and repaired. Thank you for joining us for our CARF Health and Safety Training.